What is it that causes a psychotic episode?
A psychotic episode, the way we understand it today, would be working with neurotransmitters in the brain and an imbalance of neurotransmitters. Why it happens, we don't exactly know. We do know the primary neurotransmitter in the past has always been dopamine, so that's been our main focus. But as we unravel the cause of psychosis, we're seeing that there are other neurotransmitters that are also involved in that. And with the new antipsychotics, you're going to see them targeting not just dopamine, but other neurotransmitters in that general area. The way we define it today, you can have a psychosis, which is a break in reality, a problem with differentiating fact from fiction or reality testing. The person might have auditory and visual hallucinations, or either or.
What is it that differentiates between psychosis and schizophrenia?
Psychosis is, if you will, a symptom or a set of symptoms in this, and rather than a specific disease, in the same way that, for example, a fever is a syndrome or a symptom, but it's not a specific disease. Schizophrenia is a relatively specific disease, although it's probably a collection of closely related ones. And psychosis is a general symptom that can occur in schizophrenia, or it can occur in depression, it can occur in bipolar disorder, it can occur in anxious people, it can occur with personality disorder. So it's common to many things, but it's particularly well known with schizophrenia.
Schizophrenia is, in the old literature, meaning 20 years ago, you wouldn't be able to diagnose someone with schizophrenia until they're really at least 17 or 18 years old. Today, we have been looking at schizophrenia even in children. The difficulty is, unless you can watch it over time, over a number of years, it's difficult to get a really clear diagnosis of schizophrenia versus psychotic breaks due to any other condition. When a person looks as though they might have schizophrenia, we would, in a child and adolescent up to age 19, we oftentimes might say they have a schizophreniform disorder, meaning the first 6 months, we're not sure still if it's schizophrenia. So we'll just call it schizophreniform disorder. And after 6 months, it would go into a full-blown schizophrenia diagnosis. And schizophrenia is more of a long-term chronic psychotic situation where the patient would need antipsychotic medications for the duration of their life in most cases. Now, recent literature, only within the last year, they're saying psychosis is not a permanent condition, which is interesting because years before we'd say, well, if someone's psychotic, they're most likely going to be psychotic for the rest of their lives. We're not saying that now. So it's brand new information, it's exciting, and it's also very helpful for patients today to know that, okay, they may have had a psychotic break, but it doesn't mean they'll be psychotic for the rest of their lives.
What predisposes someone to the development of psychosis?
Well, there's a number of factors. There's been a number of theories, and there are genetic possibilities, meaning it might be in your actual DNA. So if there's a family history, mother or father or both, and if they have relatives who might have succumbed to psychosis along the line, you may have a higher chance of psychosis and schizophrenia. So when we look at the genetics and we look at DNA, there's been theories that, well, maybe it's trinucleotide base pairs that are lined up in certain arrangements that give you vulnerability to psychosis. That's where you could start, in theory. So you're looking at the DNA chain, actually, and how it is constructed. And that alone might be the beginning of the vulnerability to a psychotic break and or schizophrenia. Other things, as you go on in time, could be life stressors, environmental toxins, and a number of other variables. And this is why we don't have to this day, we still don't have a definitive answer on why some people are more vulnerable and some develop schizophrenia.
The extra activity in the brain caused by the stress leads to the neurons being more active, whether they're exciting other neurons or inhibiting other neurons, and that at some point triggers the sort of cascade that leads to psychosis. It's important for people to understand that thoughts and things that you experience can change how the brain operates, just as if the brain changes how it operates, that can affect what we think and what we feel. So it can go in both directions.
How might elevated dopamine levels induce a psychotic episode?
It's not so much that the elevated dopamine level increases psychosis or causes psychosis, but dopamine, the brain is not a big bowl of dopamine. It's a container that has nerve cells, and dopamine is the transmitter for moving signals from one neuron to another for parts of the brain, but not all parts of the brain. So when we say the dopamine activity is increased, we mean some of the neurons or some of the parts of the brain are more active than usual, but not the whole brain. And so it's not dopamine per se, it's that neuron that carries dopamine is more active. So some parts of the brain are becoming hyperactive and some parts are becoming underactive. There are other receptors, such as the NMDA glutamate receptor, that's probably more involved than dopamine. And there are other things, such as the structural changes in the brain, where some parts become larger and some parts become smaller, and the way they all interact. And then there's also the environmental factors that play a role, the stresses and so on, and what you think about.
Could you break down the symptoms of schizophrenia for us?
I usually define it in terms of you can have positive symptoms, which I'll explain, negative symptoms or disorganization symptoms. Positive symptoms are things that are added on, particularly hallucinations or delusions. Delusions are false ideas, like paranoia. And negative symptoms are when you lose something, so you are no longer sociable, you no longer are animated, your face is sort of flat and wooden, you don't express any feelings. Those sort of losses are major features of schizophrenia. And if someone didn't have that, I wouldn't think they have schizophrenia. Medications that will increase dopamine should increase psychosis, and often do, but they will not do anything to cause negative symptoms. And then the disorganization symptoms, the third group, these are things like your thoughts don't sort of make sense to other people, they're all jumbled together, and so on. That's a third area, and that's partly affected by the dopamine and other neurotransmitter things, and partly is separate and probably related to the changes in the brain structure.
How can psychosis lead to the development of schizophrenia?
I think the question really is the other way around. How does schizophrenia lead to psychosis? It's not that psychosis comes along and triggers schizophrenia, it's that schizophrenia comes along and triggers psychosis as part of the illness.
Would the onset of psychosis occur before other symptoms of schizophrenia?
That can occur, but we would regard it, at least when we understand what's going on, as the first manifestation of the schizophrenia itself, rather than something else coming along and triggering schizophrenia. Because schizophrenia is defined as a long-term illness, we don't usually diagnose it until we've seen a person display it for a period of time. Officially, the diagnosis is that the symptoms have to be present for 6 months, which means that if you suspect someone has it in the first month, you don't officially diagnose it until 6 months later.
What is a psychotic break?
Psychotic break is something where you would have these psychotic symptoms. And it's a component where you might also see in depression or anxiety or possibly a personality disorder, such as borderline personality disorder with psychotic breaks. So that psychosis could be on a timeline, though. It might be, okay, the person developed a psychosis due to a stressor. They could have also, though, been indulging in street substances, alcohol. A number of different things can cause psychosis, and that's usually short-lived. And when we say that, well, how long? Well, it could be weeks, months. Younger children, and I can speak to as a child and adolescent psychiatrist, their brains are robust with neurotransmitters. And because of that, they could have psychotic break and, in theory, resolve quite quickly. And we do see that more often. In the adult, when the neurotransmitters are set up, you're going to see the adult have a psychotic break, but they're usually into it for 3 weeks, 4 weeks, 6 weeks, a much longer time period.